will be starting with the topic the deaf child. What are the causes of deaf child? That the child is born deaf, or a child uh, less than 6 months of age is deaf. The causes can be prenatal, which is like before the delivery. It can be perinatal during the delivery, and it can be postnatal. So we'll be starting with prenatal. So in prenatal, the cause can be like related to baby or related to the mother. So what are the causes related to the baby? It can be anomalies, that the baby is having anomalies. So now these anomalies can include the inner ear alone, or it can be a part of syndrome. So it can either be syndromic or it can be non-syndromic. So when it involves inner ear alone, which is non-syndromic, it can affect only the membranous labyrinth, or it can affect both membranous and bony labyrinth. These are the anomalies that can occur in the child. Regarding the maternal causes, it can be infection. Infections are torch infections, like which are passed from mother to the baby. It can be use of any ototoxic drugs during pregnancy, or it can be any nutritional cause such as use of alcohol or any deficiency, or it can be any radiation exposure. So these were the prenatal causes. Now coming to perinatal causes. So in perinatal causes, there can be any trauma during delivery, if there was any instrumentation delivery or something like that. It can be sepsis, and it can be anoxia during delivery. It can be preterm labor and low birth weight babies. It can be use of any ototoxic drugs, etc. So these are the perinatal causes. Now coming to postnatal causes. So postnatal causes it can be genetic or it can be non-genetic. Genetic is much more common, and in non-genetic it can be due to an infection, due to any use of ototoxic drugs. It can be due to serious otitis media, or it can be noise induced deafness. So these were the causes. Now we'll see how do we evaluate a child with deafness. First of all, we need to find the cause, and before finding the cause, we need to see whether the child is deaf or not. So, when does suspicion of hearing loss come? Like when the child is sleeping soundly in an environment full of noises, or if the child is like having partial hearing loss, he or she can like have a poor performance in school, or the speech can be dysregulated, or something like that. So, we need to assess the risk factor. Risk factor are the causes we did earlier. So, how do we evaluate a child for deafness? So there are various procedures. First of all, we will see screening procedures. In screening procedures, we do two things. First is the autoacoustic emissions. So what are autoacoustic emissions? They are started from the outer hair cells, and they travel in opposite direction, like from outer hair cell to tympanic membrane, and then to the ear canal. So we can get these waves through the ear canal. So these autoacoustic emission, or OAE, are absent when there is any defect in the outer hair cell. So when there is cochlear defect, but they will be normal if the defect is like prior to cochlea, like there is any eighth cranial nerve defect. So other from autoacoustic emission, we can check ABR. What is ABR? Auditory brainstem response. So when the sound is sent through the ear canal, through ear, the ABRs are felt through scalp. So we can assess them too. We can like see their generation. Uh, so apart from that, there is arousal test. So like a high frequency sound is given for 2 seconds, like 3 times. So a normal child would be evoked or aroused by at least 2 times out of these three. So that is one test. Apart from it, we do behavior observational audiometry. So like whenever there is a sound perceived by a child, he or she will show a change in behavior. So like if the child is doing some activity, they will stop doing that activity. or there will be sudden movement of limbs like due to the sound, so we can check that. Then there are distraction techniques, like a child is resting peacefully in the mother's lap. So we will produce a sound like from back or from the side, and then the child will respond or move their head in the direction of sound. So this is a distraction technique. Then there are conditioning techniques. So in conditioning techniques, three things come. First is the visual reinforced audiometry. So in this, the point from where the sound is coming, we also like start a light action from there. So a child will see that light from where the source is coming. And apart from it, there is play audiometry. So in play audiometry, the child is asked to put some object in a cup or something when they hear a sound, and if they put it, they will get some reward. So this is play audiometry. Apart from it, there is speech audiometry, where we say some words to the child and they have to repeat it, and then we will gradually decrease the loudness of the words we are speaking. Then there are objective tests. So objective tests are same as the screening test. They can be used as an objective test too. So they were like autocaustic emissions and ABR, which was auditory brainstem response. Apart from it, there is electrocochleography, there is impedance audiometry. So now coming to management. So what comes in management? First of all, there is parental guidance. So the parents needs to be counseled regarding the deafness of their child. And apart from it, if there is any residual hearing which is probably there, so we will be giving hearing aids or cochlear implants. And if they can't be given, we will help the child with development of speech. Now the speech, they can be educated about like lip reading or the sign language. Then there are various school for the hearing impaired child, they can be sent to there. And there is vocational guidance. So that was all about the deaf child.